approximately 25 to 30% of my patients have spoiled their liver by themselves through alcohol. We have bypass machines that can do the function of the heart if it needs. We have dialysis machines that provide the function of the kidneys if you needed it. But till date, there is no machine that can replace the function of the liver. In early stages, it can be managed with limited operations to remove it. In later stages, it needs a transplant. My message is one of hope that liver cancer is not a death sentence. Please get good advice, and hopefully it is still curable when we get to you. Hi, my name is Dr. Tom Cherian. I am a professor of transplantation and founder of South Asian Liver Institute. Now, South Asian and Wockhardt Hospitals is hoping to create a beautiful facility for patients with liver disease. And one of the commonest questions that I get asked in my clinic is, Doctor, what is the use of this liver? What does it do? We don't know much about it. The truth is, the liver is possibly one of the most complex organs in the body. Now, even in 2022, you can have ventilators that take away the function of the lung if you need. We have bypass machines that can do the function of the heart if it needs. We have dialysis machines that provide the function of the kidneys if you needed it. But till date, there is no machine that can replace the function of the liver. That tells you about the complexity of the organ, that despite our technology, despite our science, we are still not able to create an alternative. The reason for that is, the liver is not simply a pump. It is not simply a filter. It is an organ that has got over 400, 500 different functions. From something as simple as temperature regulation, to maintaining your glucose levels, to metabolizing your food, all of it is centered around the liver. And therefore, liver failure can present in different ways. I'll give you some examples. When there is liver failure, the portal pressure builds up and blood vessels can burst inside, causing GI bleeding. So that's one function. Another time would be the liver is meant to detoxify the toxic metabolites like ammonia. But when in liver failure it is not cleared, the ammonia goes into the brain and causes coma. So the liver has got hundreds of functions and it cannot be replaced even in 2022 except with a liver transplant, where we use a liver from another human being. And therefore, my plea to all of you is, please take care of your liver. You need it. This is just water, but I think you know what I'm talking about. And I'm always slightly saddened by the fact that approximately 25 to 30% of my patients have spoiled their liver by themselves through alcohol. So my message to people who drink is, I don't need you to stop drinking, but I need you to be aware of what is going on. So think to yourself, do you need to have alcohol before you go to sleep? Do you have to have alcohol on a daily basis? Are you needing alcohol early in the morning or any time during the day? Are you drinking by yourself? These are key questions to ask yourself. And if the answer is yes, then it is a sign that you're going into an addiction. And once you go into an addiction, then there is a high chance that you will develop cirrhosis at some stage in your life. And therefore, social, what I would call harmless drinking, which is 1 or 2 units a week, which may be a can of beer or maybe 2 glasses of wine a week, as a social exercise to spend with friends or family, is acceptable. But when you're reaching a stage when those questions that you had to have alcohol, then you know that you're getting addicted. And therefore, then you need to find some way of stopping yourself before the liver is completely spoiled. What I would like you to know, that is an early liver disease. Even if you stop drinking, you can still regenerate your liver. The liver has got a beautiful capacity to regenerate, and it can improve it back to almost normal. Whereas if you drink a little bit too far and if you got cirrhosis, then it is irreversible, and the only treatment is a liver transplant. I hope you never reach that stage. And one of the things that we are very passionate about is liver cancers. Liver cancers is a diverse group, and it comprises mainly of maybe 3 or 4 major cancers. One is hepatocellular carcinoma, which is a cancer of the liver cells. Second is cholangiocarcinoma, which is a cancer of the bile ducts. And third is liver metastasis. So cancers elsewhere, especially from the colon, is brought to the liver via the bloodstream, and that causes new cancers inside the liver, which are called liver mets. Number 1, HCC or hepatocellular carcinoma, commonly seen in patients with cirrhosis, very rarely in patients without cirrhosis. In early stages, it can be managed with limited operations to remove it. In later stages, it needs a transplant. Very often, it does not produce any symptoms until it's very late. So therefore, please, especially if you know you have hepatitis B or C or liver disease due to any cause, please get regular ultrasounds to detect this early so treatment is possible. Cholangiocarcinomas is supposed to be a death sentence, a very terrible cancer, they say. But it is a good cancer in some ways. It doesn't spread so much. Therefore, with good surgical skill and expertise, you can remove cholangiocarcinomas and get excellent long-term survival. Third thing is colorectal cancer with metastasis to the liver. This is a disease that has got excellent response to chemotherapy, and a combination of chemotherapy and surgery can cause cure, and even 30-40% of people can reach 5 years and 6 years survival even after such surgery. And if they survive for 6 years, often they're cured and go on to live a normal life. So my message is one of hope that liver cancer is not a death sentence. Please get good advice, and hopefully it is still curable when we get to you.